I will present myself. I'm a gynecologist working in Milano. I was the founder of the Italian Society of Supplements 20 years ago in OBGYN because I understood how our patients, how the women, they don't want no more drugs and they are falling in love in supplements. And then is arriving the microbiome revolution, and then the possibility to use these fantastic supplements that we call probiotics for treat, for help, for prevention, and for therapy in all ages of our patients. You can see my book here in the presentation, and I'm sorry that I post my book, but there is a reason. Because I wrote this book with a nutritionist. In my idea, the first supplement, the first situation to do for a good life, for a good quality of life, is a good food. And so we published together 1 month ago this book, me and Silvio Soligon. So we start from this famous revolution of the human microbiome. Finally, the healthcare professional, medical doctors, the gynecologists, or the gastro, the pediatricians, we learned that the microbes are not enemies, and maybe they are friends. They have only to live in peace in the body of our patients, in the body of a woman. I think that we are starting only with the vaginocentric attitude. When we check a patient, when we check a woman, we look on the vulva, on the vagina, on the uterus, and the ultrasound. We have to understand very well the total body of this woman. And the owner of this body, there is the gut. The gut is the first situation, important situation, for gut-brain axis and for gut-urogenital axis. This webinar today, I will speak with you in what we can do helping our patient treating the gut and helping a lot of bad situation. The first things that I am telling you that I'm very, very afraid in the antibiotic resistant problem. In Italy, we are crazy. We prescribe a lot of antibiotics. I think that we will all die in the next 30 or 50 years of this big war. So we have to do something together and not to use so much antibiotics, but something different. So this incredible picture, this cartoon, is not so old. It's not 100 years ago. It's not another century. I think 10 years ago, we were washing vagina. It was so stupid, prescribing antibiotics and telling to our patient to wash the vagina. But wash the vagina, you can wash all the things, the bad things and the nice things, the good thing. And so it's an incredible old situation, and that now we are in the future. And the future is a personalized medicine. It will depend on how much trials, how much scientific trial and good trials we can do and we can publish for in the microbiome of vaginal microbiome, bladder microbiome, helping our patients with biotics. I'm starting with this word biotics and not probiotics, not only probiotics. So nowadays, we know that in the gut there is always a chronic low-grade inflammation. And this chronic low-grade inflammation is the real problem. The real problem because under the gut of our patients, there is the bladder, there is a vagina, and so the association between vulvovaginal discomfort and activity of inflammatory bowel diseases is, we know that we have to help our patient to treat and to respect the gut. This is so important. Yes, we have a central role of this gut. A new therapeutic approach we take from the gastro and we take from the pediatrician to only in the last 10 years that the gynecologists, they are using so much and prescribing so much probiotics. I told you the gut and brain axis, for the mood, for a lot of big problem, but today we will speak together of this axis, gut urogenital axis. And so we have begun to prescribe probiotics helping our patients. But what is the new situation is not only restoring the gut, but it's using new strains with a strain specificity. The strains that I will explain in this webinar to you, in these 3 products of Zinereo that I will present to you, they have a very, very specific, a big activity that we call strain specificity. And this is a very new. Only in the last years we can in vitro and in vivo tell to our patient, spend this money, I will prescribe this product to you. I am sure that these strains, they are really working in your problem. So this year I was round around in the world with very interesting and very new convention. I'm very proud because I was the speaker in the US. They called me to be the speaker in Probiotica America. And then it was very interesting in Copenhagen, this Microbes in Women Health Congress. And what is new? It's new that there's something new. In the word biotics, is probiotics that you know very well, prebiotics, symbiotics, and then it's starting something new with this, the postbiotics, and with the next generation probiotics. We will see together, and next generation probiotics is no more lactobacilli or bifido, but this is something new that can help very well our patient. And then another new word, a little difficult, but I think very important, the live biotherapeutic products. What are the live biotherapeutic products? They will be drug. They will be probiotics built like drugs. And then we will see together what is this opportunity. The definition, you know very well, the poor definition of probiotic. It's so old, it's so poor, this definition. We have to prescribe to our patient this packaging. We will see later how it's difficult without claims. It's impossible to write on the packaging the claims of these probiotics. And so only very good counseling from the healthcare professional to our patient to convince our patient to buy this product. Definition of probiotics in Italy too is something so incredible. Live microbiome that when administrated an adequate amount confer maybe a health benefit on the host. So it's incredible because we have these strains, these super strains, these power strains, and then we can't write a claim. We can't write, and we have only to explain how they are very well working. The prebiotics, they are the food for the probiotics. But in prebiotics, there is something new. This substrate that is selectively utilized by host microorganisms conferring a health benefit maybe is something moving. There are any prebiotics using alone without probiotics, and they have a big immunity effect in the gut. So probiotics and prebiotics together, they are symbiotics. And this is old situation, and you know very well this situation and these definitions. The new world of postbiotics. Postbiotics is not only a dead probiotic. It's not only to kill a probiotic and to make a postbiotic. But postbiotics is something working very well. Bacterial-derived products derived from bacteria that are released during fermentation processes of food materials. So there is a new world. I'm working in this important hospital in Milano, in Italy. The name is Humanitas. I'm teaching in Humanitas University. And there is Professor Maria Rescigno studying and working in this field of postbiotics, and they make an incredible, very, very serious double-blind trials. Incredible. I was incredible seeing how much we can do using these new postbiotics. And then I told you before, this next generation probiotics, innovative group of beneficial bacteria currently undergoing research and development. So we have to wait a moment to understand a little better what is coming with this definition of NGP, next generation probiotic. They are designed not only for conventional use as foods or dietary supplements like our dear probiotics, but are also tailored for drug application, for pharmaceutical application to make a drug. In Obgyn, in our job, in our work, in our dear patients, what we can do helping our patients during life, a lot of things. Restoring the vulvovaginal ecosystem, the dysbiosis of the vagina, in infertility. In Spain, they are working a lot, and you know that in Spain they are famous for working for infertility and helping couples with infertility. And so they are starting with very interesting trials and products against helping the couple in infertility, urogynecology, cystitis, and then the big field of menopause. Menopause is like half of the life of the woman, 30. We say 20, 30 years of the life of the woman. But in 2060, hear me, in 2060, in Italy, I think in Europe, menopause will be at the middle of the life of the woman. And so we have to help this big problem of menopause, and we can help using biotics and probiotics. And then the big future for pregnancy and breastfeeding, we will look together what we can do helping our patient. And in numbers, I think Lumina data, and I'm helping International Probiotic Association. I'm working in the scientific board of International Probiotic Association, and Lumina is a company that give us any important data. So in 2023, Europe was a very market for growing market for supplements for probiotic, and Italy in Europe is the most important market now. And then we know very well the probiotic story, and it's a lot of years that we are working and falling in love in this field. But what want to know our patient? Our patient, they want to know something more. So I explained you before the big problem of the claims. I think now something is moving in Canada. I don't know other countries where you can write the claim on the packaging of the probiotics. Yes, probiotics is not a drug. I can understand. You spend a lot of money and a lot of time when you make a drug and not when you register as supplements. But these probiotics are so incredible, so good working. There's a very stupid thing that we can write anything on the packaging. So the problem of no claims for our patients, a big problem, and regulatory. You know, I'm a medical doctor. I don't want to know these things. So I want to have good products to prescribe to my patients, ethical prescription. But if you look at this cartoon explaining something of the regulatory, you can understand that probiotics are in the food, in the medical food, in the cosmetic products, and the skin, you know, the big situation of the skin. And then they are arriving these live biotherapeutic products. They will be drugs. I think that I know that in US and UK they have a lot of money because you have to invest a lot of money to make a drug. They are in phase 1, on phase 2, making these new products with probiotics, and they will be drugs, and so then in the future you can write the claim of the product. But in this situation, in this moment, we have to try in our probiotics to explain, I told you, with a good counseling to our patients what to do. And why our patients, they like so much probiotics? Well, they are natural. Antibiotic and antimycotic are not natural, without side effects. I am sure that there are not big side effects taking probiotics. I'm not sure with antibiotic. And we can write with specific activity against pathogens. I told you before, the strain specificity is that this strain of probiotics is working in vitro and in vivo, like and then antibiotic without side effects. But the big problem, our focus, our gold standard are the relapses, the prevention of the relapses, of the recurrences of the terrible cystitis and vaginitis. And then, you know, we can help to balance the vaginal microflora when we prescribe antibiotic, but it alters also commensal positive bacteria. So we kill all. After a cystitis, we prescribe always antibiotic, but we kill the lactobacilli of the urobioma. So in gynecology, we can use probiotics for vaginitis. This was the first big market. Market is not a nice word for a medical doctor, but it is market. There's a lot of money. Patients spend a lot of money, and the companies, they invest a lot of money in this field. Metabolic disorder, the HPV clearance, we have to be very serious with HPV and with infertility too. We don't kill the virus, but we help this vagina to have a fast clearance of the virus. I think that a vagina in eubiosis, not in dysbiosis, so if we put in eubiosis a vagina, we help this vagina for the clearance, for a fast clearance of the HPV. Cystitis, you know. Infertility, I told you, is very interesting to treat the couple, the man and the woman, for infertility, for the sperm motility, for the vaginal dysbiosis. It's the same with HPV. This vagina is in peace. It is in eubiosis. It's clear that it's coming much more to have to be pregnancy, and the clearance of the HPV is faster. In pregnancy, now we will see together something very interesting in that we can do prescribing probiotics in private. And then I told you before, menopause, UTI, atrophy, gut dysbiosis, osteoporosis. There is a nice strain working in osteoporosis and in the mood. This is the other axis. This is a gut and brain axis, but always working and treating with the probiotic. The vagina forest. This is an old slide of mine. My life so much. This idea that the vagina in eubiosis is like a fantastic green forest. All the animals, all the plants, they are in peace. The human vagina is home to an ecosystem of commensal bacteria and yeast. It's the only, no fighting. When is coming something bad, when is coming the dysbiosis, like age, sexual intercourse, menstruation, stress, diet, and a lot of things that you know, and something that we don't know. And then is coming this incredible war in this vagina that we call dysbiosis. You can see on the right the cartoon. In eubiosis, a low microbial diversity. In eubiosis, we have a lot of lactobacilli, a low pH, a good vaginal epithelial layer. When it's coming dysbiosis, the diversity is higher, lactobacilli is lower, and pH is higher. And this you know very well. Oh, it's interesting that I show you. And then I tell you again that the lactobacilli, with strain specificity, they are our future. And we can prescribe ethical to our patient because now we know that this lactobacilli that we are sure that we put in our products, they are really working. You know that my friend Jacques Ravel, 10 years ago, I met Jacques Ravel in Copenhagen. This year, I will meet again next year, I think, in Amsterdam. And she published a famous study, changing a little the situation, and telling us that in a healthy vagina, there is this Lactobacillus crispatus, then there are other Lactobacilli, Caseri, Inners, and Jenseni, and there are 5 or 6, how do you want, community state types. So we can understand where is a healthy or sick situation in vagina, looking with next generation sequences with NGS diagnosis, how is the situation of this community type. But it's not so easy. I have a big discussion with Ravel together, a table. We have a long 2 hours in the table discussing with Ravel, and he told us this is not easy to put a woman always in one community state or in the other community state, because during the life is changing, during the quality of life, during the food, the sexual situation, the stress, and a lot of factors, they are changing in the vagina, this situation. But we have to know the community state 1 is a lot of crispatus. Crispatus is the best. Crispatus is our friend. And the other community state, they are mixed situation. The function of the lactobacilli, you know, but we can repeat together. The acid, lactic acid, help to maintain the pH, inhibiting the proliferation of the pathogenic bacteria. Lactic acid is really a good, incredible, helping us against the bacteria. And the hydrogen peroxide, toxic to anaerobic pathogen, directly destroy pathogenic anaerobic bacteria. And bacteriocins, they are like antibiotics, like small antibiotics. They are working really. in the convention, around in the convention, there is a lot of people studying this bacteriocin, explaining us that there are really any bacteriocin working like an antibiotics, inhibit the growth and the reproductive success of the competing pathogens. And then the biosurfactant reduce the surface tension and have the ability to disrupt and dislodge the pathogenic biofilm. Later we will speak together about the biofilm. The bad biofilm is so important. Decolonization is all. I told you about ethical prescription. I told you that our patients, they have to spend money to take this oral product. This oral product, they have a long trip. They have to go to the mouth, to the stomach, to the intestine, to the gut, to the colon, and then jump in vagina. So we have to be sure for the companies that they're selling the products, that these oral products, they are arriving in vagina, in the gut first, and then in vagina. So the colonization of oral supplements is absolutely so fondamentale, assolutamente. We prescribe these probiotics to treat our patient, but we must to be sure they reach the vagina and the bladder. Vagina and bladder is fundamental, and have a good colonization. I don't want that all this they are having very nice so big numbers of this lactobacilli. I want that any lactobacilli, to be sure that any lactobacilli they are arriving in the gut and vagina, helping my patient. There are a lot of papers. There are a lot of papers, and there are a lot of companies working with trials, spending money only to publish the colonization of the strains. Oral versus topical. You know the big problem, because you can tell me why we don't use vaginal probiotics. Yes, I publish a lot. I was falling in love with vaginal probiotics, but the regulatory now blocked the possibility of prescribing non-drug vaginal probiotics. So we have to wait, maybe live biotherapeutics. We have to wait something new. I think that we have to wait any years more. We wait drugs, probiotics, drugs that we can prescribe in vaginal situation. So we wait, and then now our patient need absolutely that we help, and so we have our probiotics, and we use our probiotics. Probiotics duty for vaginal health is the fundamental that we have a multi-strain supplement. I don't believe in the monostrain. I think that multi-strain supplement increases the potential and specific benefits of different strains, because one strain is helping the other strain. I told you of the strain specificity is tested, clinically tested strains in vitro and in vivo. I told you about the colonization. I want that these oral products arrive in the target. The target is the gut and the vagina. Oral versus topical, because now we have no drugs to put in vagina. The big problem, our problem every day, we are working by telephone or in our office, or checking our patient with this big problem of the recurrent vulvovaginal infection. The two famous infections, the bacterial vaginosis and yeast and candida yeast infection. This is the first reason of gynecological medical checks in Western countries. I told you there's a lot of money in this market, because these poor girls, these poor women, they are spending a lot of money. maybe something is not a right diagnosis, and so they take anti-fluconazole treating bacterial vaginosis, or metronidazole treating yeast infection. It's really a big problem. We have to help these girls, to help those women. The solution is restoring the vaginal microflora with lactobacilli. The recurrent vaginitis, there are incredible big problem, itching, discharge, odor, fish odor with the bacterial vaginosis, and they are incredible social, psychological, and economical damage for our patient. And any doctors, any medical doctors, any gynecologists, they make diagnosis by phone. Other patients, they make it with Dr. Google. Often they call their doctor and after self-treating at home. Symptoms are often confused or complicated by irritation, allergy, or other systemic disease. So we can prescribe exactly the right antibiotic. In acute episode, it's ethical to give a short therapy or fluconazole in yeast infection, or metronidazole or clindamycin in bacterial vaginosis, but only for 3 days in acute episodes. In recurrences, in relapses, we have to do something different and something more. You know that Candida live in the gut, live normally in the vagina. It's a commensal. It's not an enemy. 10 years ago, 20 years ago, the patient, they ask us, my boyfriend or my husband, they give me Candida, give me yeast infection. No, it's not so. The Candida live in your gut, live normally in your vagina, and then sometime in physiological condition is silent and has the shape of blastopore, stay in peace, living in the vaginal epithelium. And then we don't know why. Sometimes we was thinking for the food, for the sugar, for the quality of life, for the smoking, for the sexual intercourse, but we don't know exactly why. When Candida becomes a pathogen, takes the shape of IFA, and the vaginal candidiasis occurs. And so there is a dynamic balance and non-active immunosituation of the host. In this terrible relapses, we can't give only antibiotics. We can give only fluconazole. Fluconazole, I repeat, in the acute episode. And then we have to help with natural products, with our probiotics. BV, bacterial vaginosis, is the other phase. It's a syndrome. It's not an infection. It's not an infection. It's the modification of vaginal microflora by reduction of an imbalance. So it's an imbalance of lactobacilli, a dysbiosis, a syndrome. Different microbiome in different ethnicities. You know Gardnerella, Prevotella, Mobilincus, you know very well of the situation, you know the numbers, the incidents are incredible, and the relapses and the recurrences are the same, terrible. BV is a polymicrobial syndrome resulting from replacement of the normal hydrogen peroxide producing lactobacillus in the vagina with high concentration of anaerobic bacteria. So we have to help our patient in this situation. In this situation, they have big risk. You know, it's not only the fish odor or the discharge the problem, but the problem of the BV can be very incredible, hard during pregnancy, because there is increases of preterm birth. And you know this preterm birth is terrible cause of in pregnancy, and we have to all together to fight and to help a reduction of preterm birth, and so we can prescribe in risk in pregnancy with risk factors probiotics, helping to let a good environment, a good microvaginal microbiome, and helping against BV during pregnancy. I told you how is important the strain specificity. We know this is one of a lot of published trial, very interesting, because I can tell you that sometimes the probiotics, they are working against the bad biofilm. You know, the organization of the bacteria in biofilm, this is the big cause of the relapses, of the recurrences, and is better helping a probiotic. It's better to treat probiotic. The bad biofilm is easier sometimes than treat with antibiotics. We can use together, or we can use only probiotics for a long time against the organization of the bacterial bad biofilm. The pregnancy, the very important, there is two possibilities to help during pregnancy our patients, and then, you know, to prepare the vaginal microbiome to give during gestation and after, during birth, during delivery, for preparing and to helping the first 3 years of life of the baby, the first 1,000 days, the famous 1,000 days. The modulation with probiotic of the vaginal and intestinal microbiome in pregnancy has two very important functions: helping during pregnancy against a lot of problems that we will see together something now, and giving a good microbiome to this child, to this baby, helping in the first 3 years. In the metabolic disease, maternal overweight, gestational diabetes, gestational dyslipidemia, and hypertension, there are of published trials that treating with probiotics this risk pregnancy. I don't want to prescribe to all the pregnancy women probiotics, but I want to understand which pregnancy is a little with risk, and I want to help this 9 months, 6 months, because I'm prescribing from the second trimester probiotic, and helping against this big problem of the metabolic disorders of our patients during pregnancy. This is a work, I show you one of my published work. Why? Because using a couple of strains, I am giving this couple of strains after delivery to this patient to reduce the postpartum symptoms like depression and mood, and to have a better breastfeeding. So it's incredible that the key findings was mother depression minus mother depression minus mastitis and baby crying. So this is a small but very interesting published trial, and I want to show you how it's important to help in pregnancy or in puerperium after delivery our patient with probiotics and working in this big inflammation of the gut. We arrived in the menopause world. The menopause world, I told you, is an incredible world, because these girls drinking tea, they are so afraid of what? Of hot flashes, insomnia, a lot of problem, mind problem, physical problem, atrophy, etc., etc. Because without hormones, without this fuel, When I'm teaching in university menopause, I say that a woman of 50 years old is like a Ferrari in highway, a red, fantastic Ferrari in highway stopping. This young girl of 50 years with young children, with the husband, with a boyfriend, with an important maybe work or job, can't stop. And so we have to help. Giving again, we know something like hormones. This is the first things, and then helping absolutely this big problem using probiotics. So we can prescribe probiotics in menopause for a lot of situation and to work against the big problem of the inflammation of the gut. Another of published trial, published work, I decided to give 3 strains of lactobacilli during menopause to these patients, and I have, this is normal, a reduction of pathogen in lactobacilli in vagina, but the big gold standard of this trial is the reduction of inflammatory profile. Doesn't mean that taking probiotics during menopause, we can work against this big inflammation of the gut in menopause. Without hormone, it's a big inflammation, much more than the old low-grade chronic inflammation, high grade. This is the future. We are at the end now, and this is the future. I was in Copenhagen with Laura from Hopkins University. This is phase 2. They are arriving. They have a lot of money. They invest a lot of money. But the idea is the transplantation. If you can make a gut transplantation, we can make a vaginal transplantation against vaginosis, bacterial vaginosis. Vaginal microbiome transplantation in women with intractable bacterial vaginosis. What does it mean? We try in acute episode with antibiotics. We try with long-acting probiotics. If it's nothing to do, we will have in the future the possibility to try with the transplantation from the microbiome, from environment, from a patient very healthy to another patient with a bigger problem. And how we can help our patients in all this long situation that I explain you with 3 products of Zinereo, three nice and important products of this company. Again, against vaginitis, cystitis, and in pregnancy. They make 3 products, one for pregnancy, one in relapses, recurrences of vaginitis, and the other one for the big problem of cystitis and for the urobiome. Starting from the mother microbiota, I told you before how it's important helping the imbalance against the BV in pregnancy and helping the gut, because the gut is the first situation from what is coming out of bacteria to vagina. And then the new idea of the maternal microbiome send messages to the baby microbiome. Prenatal microbiota, we are sure that influence the development of pregnancy and the future health of the baby. So now it was only an idea 10 years ago, maybe in the future we can prescribe probiotics during pregnancy, and now we are sure that we need to prescribe in pregnancy, not in all pregnancy, but in situation of risk pregnancy, probiotics. This is my idea. Cesarean birth or vaginal birth, you know that is much better the vaginal birth. It's not so easy. Now we have in Italy reduction of cesarean birth. It was terrible. The numbers of cesarean births in Italy was really incredible. Now the new generation of gynecologists, they are quite women, no more men in the university studying gynecology and obstetric, and maybe they are a better mind, and so they are reduction of the cesarean birth. This is a very good thing because with vaginal birth, the mother microbiota comes into direct contact with the baby, and then I repeat, the breast milk contains a greater abundance of probiotic bacteria like bifido and lactobacillus. Immune system begins in the womb and then is arriving mature during the first 13 months of life. So it's a really big investment. The scientific evidence, I told you before that the strain specificity, I want to see, I want to know really the trials and then the study of these strains. You know, the lactobacillus GG, the rhamnosus GG, I think that, not I think, I'm sure, is the most studied strains in the world. This is fantastic strains working very well in the gut and helping a lot in this whole situation that I told you during pregnancy. And the bifidum, a specific bifidum, is helping the GG. And then there are the prebiotics, like the food of these two strains of probiotics. And so this is a very good product. So we have in this Geneva M 3 possibility action. The GG and the bifido, the rhamnosus GG and the bifido with prebiotics and with vitamin C, double protection, mother baby, and at first scientific evidence that they are really working very well with the baby and with the mother. So I think it's a very serious product. Again, with the problem of the relapses and the recurrences of our two friends, our two vaginitis, the BV and the VVC, I told you before, we have to fight the antibiotic resistance, to use a short antibiotic only in acute episode, and then we need something to help our patient against the relapses. And so we can make a protocol for any months and then to repeat, speaking and making a good counseling with our patient, understanding how it's going, and prescribing absolutamente lactobacilli, propolis, hibiscus, and vitamin A. Crispatus, acidophilus, and plantarum, there are the 3 strains that we are using in these products against the relapses, not only against the relapses, but we can prescribe this product in a subacute episode. We treat for 2 days, 3 days, or maximum 5 days with antibiotics, and then we can start prescribing these 3 strains of these products. That was Geneva V. Hibiscus, propolis, and vitamin A, that are helping this product for work very, very well. Again, scientific evidence, absolutely. Oral use, gluten, lactose free, this is important, you know, for women of all ages. Menopause, during pregnancy, and in gynecology, and young girls, we can always prescribe this product and decrease the dysbiosis and helping against this terrible vaginitis. At the end, the urinary infection. The cystitis, you know the situation. You know very well the incredible numbers of this problem. You know that E. coli is the killer. I think the 85-90% of these recurrences of cystitis is E. coli. E. coli is living in the gut. And so I repeat all the situation that you know very well. We have to treat the gut, to have a good food, and then to take something, not only probiotics, to take something natural helping in the cystitis. There are a lot of products in the world. Yes, there are a lot of products helping in this situation. And Zinereo with this Geneva U with lactobacilli, and the king or this di manoso lactobacillus is very important, but you know that without di manoso we can treat, because di manoso is like an antibiotic, a natural antibiotic against the E. coli. And propolis and vitamin C, again helping our two strains with di manoso. I think that is a very good product, again with scientific evidence, with oral use, and again gluten lactose free, and we have to prevent cystitis and recurrency. It can be a very big problem if you let the cystitis without cure. We can give always antibiotics, and so we have to balance the urobiome like we make with vagina. And so we are at the end, and the take-home messages. The mother, we start from the mother, is important, most influential factor in the development of the baby, the microbiome result of pregnancy, for birth and for breastfeeding. So helping the pregnancy and helping the baby. A healthy gut and vaginal microbiome is critical for urogenital health. For the gut and urogenital axis is so important. The aim at the urinary level is to use the oral probiotics, a positive effect for prevention of recurrency of UTIs, including the terrible cystitis. So our probiotics can be a useful adjunct to standard therapy short antibiotic therapy to treat and prevent vaginal infection and urogenital infection and bladder infection and the terrible recurrences. I thank you a lot, Zinereo and Ana Nunes, and for this 55 minutes that I have talked with you, dear friends and dear colleagues. You can write to me to my email if you want. You can ask to Ana Nunes to have my email. Thanks.